This is Steph from Voices in the Valley, and we have Dr. Bransford here from Stillwater Medical Group for our medical moment. Dr. Bransford, welcome. Thank you for coming on Voices in the Valley.
Good to be here. Another beautiful day.
Oh, absolutely. Well, Dr. Bransford, I remember at one time people didn't really think that emotions impacted health, but I think we now know that that is not true. Could you speak on emotion and how it can impact our physical well-being?
I would be glad to. What happens to our bodies with unexpressed emotions, which is what you'd asked me about.
Ooh, yes.
They get stuffed in the basement of our brains, and then they bang to come out.
Ooh, that's poetic.
Let me explain. So
Okay.
there's kind of three components to emotion. There's the subjective feeling,
Okay.
the feeling you have when you're joyful or upset or anxious, just that feeling. There's the physiologic response, which sometimes is the same whether you're crying or laughing, right?
That's
And
true.
then there's the behavioral expression, the smile, the tears. So there's kind of three components there. It's amazing that we cry when we're both happy and when we're sad. No wonder we get confused. What happens to our bodies strongly depends on how comfortable we are with expressing emotions and whether we can express them in socially acceptable ways. What do we do when we're alone versus with our friends? When we block our emotions too much, we run the risk of losing much of our individual humanity. Fear triggers the autonomic response, as does anger. And in those situations, our bodies become extremely different, very tight, very anxious, blood pressure's up, muscles are tight, brain is functioning very limited. So a lot of things go on. When you think about animals, animals will go through these episodes where they suddenly become very upset. And after they're done, after they've chased the animal or whatever's happened, they shake. And they
Hmm.
shake for about 5 minutes to get rid of all the stresses. What do we do?
So we should really be shaking?
We should be doing something.
Is that why dancing is so good for
That's
people?
why it is. Yeah. So I think about a brain as kind of like being a home, where the living room with the fire is kind of the place where you like to live your life with connection with your emotions, comfortable with all the goods and the bads. You're there in the living room. And then there's the kitchen, which is the place where you kind of create new things, the place where you dream and you kind of come up with new things. And then there are places like the basement. And the basement is the place where we kind of stuff all those unwanted emotions.
Hmm.
And that's our natural reaction, being humans, is we tend to stuff them in the basement. But the trouble is they don't stay there. They want to come back out. And so you always have to have some way of understanding how to deal with those. So things we can do, I think most important is to be curious, to
To
know
be
the,
curious.
to be curious, to know
Okay.
thyself
Oh.
and do some sort of inward practice like yoga, contemplative prayer, meditation in all its forms. You might consider cognitive behavioral therapy, which is a wonderful way to kind of come in contact with your emotional self. If you find that you've really got so many things stuffed in the basement that you can't let them back out, that having some form of therapy is really very, very helpful. As a doctor, I spent the first 40 years of my life learning to control my emotions,
Hmm.
and I spend the rest of my life trying to get them back.
Oh, wow.
So we as a society, we really try to protect ourselves all the time. When you think about a newborn baby or a 1-year-old or a 2-year-old, when they enjoy something, they enjoy it totally. They don't have any
So we should be
protective.
throwing more temper tantrums.
Exactly. Yes.
Dr. Bransford, thank you so much for sharing. It's really good to have you, and I'm hoping you'll come back monthly
All right.
for the
Well,
medical moment.
man, how about next time we talk about strep?
Yeah, how about how not to get it?
Right.
Thank you.
You bet.